Welcome to Practice Success Beyond the Dental Chair, the podcast that is dedicated to revolutionising the way dental professionals succeed beyond the dental chair. Join us for a unique blend of insightful interviews with industry experts and valuable tidbits of information to help you thrive in your dental specialist practice. In each 20-minute episode, we'll delve into a variety of topics, including HR, marketing, innovative techniques and systems, and AI to help you transform your practice and unlock its full potential. Whether you're a dentist or a specialist looking to enhance your practice, this podcast is your go-to resource for professional, personal, and profitable success. Hello everyone and welcome. Today I'm joined by Dr David Holmes, who owns a specialised periodontal and implant clinic in London and has previously worked in Sydney and New York. I met him last year at ADX in Melbourne. As a dentist, it concerned him that people might be in unnecessary pain due to the lack of ongoing dialogue with their dentist. He wanted to stop this from happening, so he developed a system that helps people communicate with their dental practice to reduce pain. Through this, he realised that happy patients care for their dental practice through feedback, bookings, and online reviews. This was the birth of FollowApp Care, of which David is a co-founder. David, please can you tell us a bit more about your story and how the FollowApp Care works?
Sure. Hi, Michelle. Lovely to speak to you again. It was lovely to meet you back at ADX in Melbourne. Not this year, but last year. My story, I think you sort of covered it all so far. I was I grew up in Sydney and did my undergraduate dental school in Sydney, worked there for a few years. And then I moved to the US to do post-grad training there. And I was there for about 4 years before I moved to London. And around the same time, we set up our. I studied implant dentistry over in the US and biomaterial science. And actually, that comes into my story later on because a lot of the network that I made during that time, as well as the network in Australia, has really been part of how we've put FollowApp Care together over the last 7 or 8 years. So I after New York, I moved to the UK. We set up a clinic here, as you mentioned, with my wife, who's a periodontist.
Okay.
And at the same time, I had this patient who had a horrible pain experience after what to me was a perfect surgical procedure. And I just watched her suffer for a long time. And it was at that point that I had the idea, this is all pre-remote patient monitoring. And this is when apps were becoming a big thing. And I was thinking, well, she should have something in her pocket and I can have something that alerts me when her pain is going up. It was something as simple as that. And I found a co-founder at Oxford University who then started helping me put together a prototype. And we got into an accelerator, and then we realized she didn't need an app. We just needed something more seamless where the patient didn't need an app. We could just send them a message via email at the time. And later we started doing SMS and text, which works better for engaging. But really, we realized that patients love this. They really wanted to hear from their clinician after their appointment. And actually, that's not such an unusual concept. I think as dentists, we all know this. Any dentist who's built a squat from scratch or is trying to take better care of their patients knows that if you do something that you're worried you've hurt them, an extraction, or that you're worried they're going to have pain rather, you'll call them the next day to make sure they're okay. And so what we realized is we could just extend that same concept of care to every patient after every visit, and actually every patient appreciates that. The problem there is you can't scale that. You can't call every single patient. It just doesn't scale. And actually, if patients don't necessarily want to be called, they're busy. We communicate very much over text. I mean, Michelle and I set up this podcast today, and I think we've had 2 or 3 emails, and that's enough to do it. That's where we are today. People are busy, but you want to get that care across. You want people to know that you care, and so that's really where it came from. And from that starting point, we started building out what that would look like for the practice, how we could support the practice to respond to any patient concerns. And now we've made that very streamlined. And that's led to really high engagement. And then it was just a question of, well, what can we add to that engagement? Now that we've created these happy patient journeys, we've extended the care beyond the chair, as our patient care system in Australia likes to call it. And yeah, so that was where FollowApp Care was born. Yeah, and so we realized that if we add that, once we have their engagement, we can then collect feedback. We can ask them if they want to rebook. We can get online reviews, and now we're looking into further additional value for the patient. And it's really around patient. It's patient-centric technology. It's about, what does the patient want? What do they need after their visit? And we all like to think that we rebook our patients at the time of the visit, but in fact, many patients might not want to book at the time of their visit because they might be numb, they might be in pain, they might just have spent a whole lot of money. They don't want to book then and there, but if you contact them next day to make sure they're okay, then they might have questions to ask, and at that point, it rebooks. Anyway, so I've answered your whole question all in one. So.
But that's fantastic, because that's what I loved when I met you last year.
Yeah.
For me, it's all about patient experience. It's about teamwork. It's about clinical excellence. So you're condensing that all in one. And now with digital platforms and things like that, it's all about engagement and that social credibility from people and peers. They look at things like that with reviews as well. So when you're engaging every single patient, so essentially what I understand is the text goes out to every patient. Is that integrated with the practice management systems, David? Can you explain a little bit more about that,
Yeah,
please?
so it's automatically comes out of the patient management system, so there's no need to trigger a message. We've got that integration there, and then from there it just starts collecting data. And actually, that's sort of the other side of this. One of the biggest headaches you have running a dental practice, particularly a growing dental practice with associates, or a multi-site practice where you've got multiple sites. How do you manage teams across multi-sites, or if you're in a group, how do you look for ways to improve? And incorporating a strong feedback or net promoter score, as it's known in the industry, is a key part of that. Being able to measure all levels of management, whether you're a clinician managing individual patients, or a practice manager, or a manager managing multi-sites, or a regional manager if you're as part of a group, or you're a CEO if you're at the top of the group. And I think this is really something that is becoming very standard in dentistry now, is how to add a net promoter score system. It's really started at the enterprise level, the larger dental groups. Back when we started 8-9 years ago, that wasn't the case. There were very, very few doing it. We were very lucky, in fact, to partner early with Pacific Smiles Group in Australia, and they've been doing net promoter score for some time. And so we learned from that just the value of net promoter score, and really what Aftercare does by checking on the patient first, it increases the volume of feedback you get by 2 to 3 times, and that flows on to a 4 times increase in online reviews. It's all about, as we like to say, checking on your patient is the engine that drives that business growth. The care element drives the business growth.
So are they all tailored, and can you do bespoke depending on the different appointments? Is that how it's set up with the different appointment types, actually what goes out and what's communicated to the patients to get feedback?
So, well, the feedback is something that's very standard. They're always the same questions. How likely are you to recommend your dentist after your visit? You might ask additional questions like, how was your waiting time? How was the experience in the reception? How likely are you to recommend the practice itself? Did you find parking and commuting easy? We dig deeper into whatever we uncover. In terms of the aftercare piece, the how are you? That's something a lot more straightforward. Yes, we can tailor it to whatever treatment you've had the day before, and that's set up in the system. And to a degree, you can configure it if you like, but really, it's out of the box. We've spent 7 years, figuring out how best to manage the patient journey. The aftercare piece has been validated with clinical trials in the US. We've worked with partners that we're still working with our partners. Sorry. We're very grateful for their partnership with leading experts in quality and health outcome management in dentistry. It's a very rarefied field. So they're clinicians and researchers at University College of San Francisco. We're doing a lot of work there to validate just the impact for clinicians, for patients, for health outcomes, for patient satisfaction, validating that care element. So that that's all imbibed in the product. So you turn it on and it's there and working. And that's how did we get those relationships? That comes back to the relationships that I built when I was at New York University.
Fantastic. So, right, nobody needs to reinvent the wheel with the FollowApp Care. It's already done because it's best practice through the 7 to 8 years that you've been doing everything that way. What other group? Sorry?
I said that's a really good way of putting it.
Yes. And just thinking about, you talked about how you've had increased, I think you said 7 to 8% rebookings. Is that what the percentages you gave?
Yeah.
And how about income, Google reviews, sort of what sort of statistics come out from, have you got some statistics that you can give us of people who have been using this particular application and the results that a practice can possibly get?
Yeah, sure. I mean, it starts with engaging your patients. So patients love the experience that it gives them. They love receiving a how are you message from their clinician with their clinician's name, with their name, talking about their treatment yesterday. And that leads to 40% engagement or up to 40% engagement. So you sort of get 4 out of 10 patients responding to messages. Wow. And then from there, you collect 2 to 3 times what you would normally collect on feedback, because every one of those 40% will give feedback. So a 40% response rate to Net Promoter Score is really unachievable without the care element. And then once you've got that feedback, you can ask them to rebook. Now, that's a safety net. Remember, rebooking, we all know the gold standard is to rebook a patient before they've left the office.
Yeah.
So, the stat there is up to 8%. We typically see somewhere in the range of 4, 5 to 8%. We have a few high performers, but it's really that they're not doing their job in reception. So if you're booking too many, that's another indicator that we need to try and get more patients booked in the clinic. And then finally, it's online reviews. So about 1 in 10 patients who go through the system will leave an online review, and it's usually works out about 4 times what you'd normally get from another just automated requests. So it's all
exactly.
I don't know if everyone can capture that, but it's the how are you is the engine that gives you 40% of your patients clicking. Then you get everyone's feedback. It's 8% of people will need to rebook, and then you've got 4x increase on Google reviews. And that's really that's a nice early win for people who are new users, just to see those Google reviews trickling in on a regular basis.
Absolutely. So, and, Google reviews, unfortunately or fortunately, it is a very big thing. And people, when they search, they might hear from people, Facebook groups about who to go to. Then they'll do a search of your website. Then they'll have a look and see about that. Then they'll go to Facebook and Instagram and think, can I connect with them? Are they authentic? Can I, is that somewhere I'd like to go? And then they'll go straight to they'll go to the reviews to see, well, what are people saying? And that's a really important part of it. So, yeah. Absolutely, 100%.
And I think the key point is that as practice owners, whether you own a single clinic or you own a group of clinics, it's very hard to put in place systems and then monitor the outcomes of those systems and drive your teams to collect reviews or to collect feedback. It's the real pain point that we solve is that worry: are my team doing enough? Is anyone underperforming? Rather than just listening out for complaints, you have the positive feedback as well. If you're running a multi-site group and you see a practice where their customer satisfaction score or their Net Promoter Score drops, you can dig deeper. You can see individual clinicians who's doing well. So it's really about getting away from that concern that are the practices well run? Is patient satisfied? Are our customers satisfied? Are they happy? Rather than just looking at the financial outcome. And I think that's something that we get quoted often is, that just because someone is performing well financially, they may be creating other problems for you down the line. So it's important also to get that voice of customer, the voice of patient, into your quality management system. So yeah.
Absolutely, 100%. That's just perfect.
In Australia, we're very fortunate to have partnered with Centaur Software and the team at D4W and Dental for Windows. And so FollowApp Care is branded in Australia as Patient Care. So and that allows us a deep integration with their software platforms. We're very happy and proud of that relationship. So they're the best people to contact in Australia.
In summary, I think whether you're a small practice offering intimate care experiences or a larger group, as you said, aiming to maintain a personal touch across many practices, FollowApp elevates patient loyalty through retention, rebookings, and reviews. So for more information about David from FollowApp Care, including links to his work and social media profiles, check out the episode description. Thank you so much for joining us today, David. It's been a pleasure talking to you and hearing about FollowApp Care. So thank you.
Thank you.